Thank you for your time.
Welcome everyone. Today we are going to presentation our project under the title of Evaluation Biomedical Waste Management in Benghazi Medical Center by me, Usay Abdelaziz, and my colleague Muhammad Sejari, under supervisor of Dr. Nuha Mabrouk. Main objectives of our project: first, introduction, methodology of study, result and discussion, conclusion, finally, recommendation. Biomedical waste is very dangerous that can cause infections and risk to health, society, and the environment. According to a study conducted by the World Health Organization in 2018 showed that about 85% of waste generated in medical facility and hospital is considered non-dangerous waste, and the other 15% is waste containing dangerous, toxic, and radioactive materials. Recently, biomedical waste management is receiving greater attention due to the recent regulation that because of indicated management of this type of waste that can be associated with risk to health workers, patients, communities, and their environmental. According to World Health Organization, WHO, and Environmental Protection Agency of USA, EPA, are used by many countries as standards to regulate the various emission of harmful substances. While some industrialized societies are able to make their own laws and regulation that I will be describing in the next two slides. This table describes segregation and collection scheme according to WHO, classified into 6 waste categories. They are: first, infectious waste, sharp waste, pathological waste, chemical and pharmaceutical waste, radioactive waste, general health care waste. Also, according to color, container, and marking, type of counter, and collection frequency. Regarding EPA classification, they also the segregation according to color coding for biomedical waste. For example, yellow color is about human and animal waste, and the treatment way is incineration or deep burial. This is some pictures of some medical waste dealing by health worker in some countries. Collection way, this is counter of sharp. This treatment way. The aim of this study is aimed to evaluate the biomedical waste management among health workers at Benghazi Medical Center. Methodology. The study area. Benghazi Medical Center Hospital, which is a government hospital and it's considered the largest hospital in the city, Benghazi, contains 1,200 beds. This is map of study area. Study method. This study used questionnaire were distributed to various departments in hospital using interview with the target number about 300 health workers, and the study carried out of just 159 participants. The period of the survey was at the mid of February until end of March. The question include 20 questions, 70 questions with multiple choice system, MCQ, and 3 open writing questions. There was limitation of the language because most of the health workers nationality non-Libyan. Now my colleague Muhammad will be continue.
Okay, the next result and discussion. Table 1 describes general information about department, section inside the hospital, the study target, age, gender and years of experience, nationality. This table describes question of questionnaire. It was 17 questions and the answer variable between yes or no or don't know. I will describe some most important question. The question one, do you have received any specialized training course on medical waste and how to dispose of it? About 1.9 say no, others say yes. Question 12, is the use of color coding system effective in dealing with medical waste? About 59.7 say yes, 35.80 say no, 4.4 say don't know. These are other examples of question. Conclusion in summary, the result of this study show that there is enough knowledge about biomedical waste among healthy cleaning works at all departments at Benghazi Medical Center, as all healthy workers wore uniform, mask, and gloves inside the hospital. The results show that there is sufficient knowledge of the disposal medical waste. According to the international standardization, the color coding system was weakly science. 36% of workers say no in their assessment. In addition, the segregation method that can expose to works and may cause infections. And engineering, there are about 23.4% have exposed when dealing with biomedical waste. Recommendation, it should be include an advanced method for dealing with disposal of biomedical waste and intensifying training and evolving skills of works. The hospital must provide specific approaches and big using and implant color coding system. We recommended supervisor to increase the intensification of supervision on the process of sorting medical waste by healthy works, increase the awareness of works about the risk factor of negligence and misuse of needle and medical waste and their harmful effect on the hospital info. There's some reference used in our study. Thank you for your attention.
Assalamu alaikum. Welcome to our presentation, Dyslipidemia and Vitamin D Status in Diabetic Patients, presented by me, Yahya Al-Asma, and my colleague, Muhammad Sassi, supervised by Ali Al-Mabsout and Noor Al-Huda. So the first thing I'm going to do is the introduction. Okay. Vitamin D receptor and 1-alpha hydroxylase, which is necessary for the production of the active form of the hormones, 1.25 dihydroxy vitamin D. Also, vitamin D stimulates insulin receptor expression and insulin-induced glucose transport in vitro. It is also directly regulates fatty acid metabolism in skeletal muscle and adipose tissue. And low concentrations of vitamin D are associated with impaired insulin sensitivity, whereas substitution with vitamin D in the deficient state improves insulin sensitivity. And vitamin D is thought to increase insulin secretion by affecting nuclear receptors in pancreatic beta cells. There is a study conducted by Cote et al. A positive correlation was found between vitamin D levels and insulin sensitivity. However, there was also a positive correlation between vitamin D levels and insulin sensitivity in subjects with normal glucose tolerance. It has been confirmed that lowering of serum cholesterol results in a reduction in cardiovascular morbidity. There's another study, a cross-sectional study by George et al. Showed that there were positive association between serum 25 hydroxy vitamin D levels, or to 25 OHD to be short, and triglyceride, and HDL and LDL, and a negative association between serum 25 OHD and triglyceride among 8,018 subjects in Norway. Data from the study of Gadabiti VC suggests that serum 25 OHD levels are negatively associated with TC, triglyceride, and LDL, and positive associated with HDL in Americans. In addition, small and dense LDL is found to depost-temporally on the arterial wall compared to LDL, as an excellent predictor of levels of SDL has been reported to correlate to atherosclerosis. It was suggested that vitamin D has both direct and indirect effects on modifying the lipid profile, and that is one of the proposed mechanisms for the relationship between vitamin D deficiency and cardiovascular disease. And now, aim and objective of my colleague Muhammad says.
Now, as for the aim and objective of this presentation, first we have the aim of the present work is the study of the dyslipidemia and vitamin D status in diabetic patients. For therefore, we have two key factors. The first one is to know the effect of vitamin D status on the lipid profile. The second is the study of the vitamin D status and its effect on gender differences that we have. Okay, for the study design and the sample size. The cross-sectional study conducted on diabetes center and the targeted groups that diabetes patients have vitamin D deficiency and dyslipidemia, or vitamin D deficiency with no dyslipidemia, or have dyslipidemia with no vitamin D deficiency. The total number of these patients selected randomized was 165, by which 110 women and 55 men. The average age of this patient was 45 years old, with the minimum age of 18 and maximum age of 70 years old. The patients in the study categorized as the following three groups. The first one is 61 diabetic patients have vitamin D deficiency and dyslipidemia. 33 diabetic patients have vitamin D deficiency and no dyslipidemia. 71 diabetic patients have dyslipidemia and no vitamin D deficiency. Okay, now the questionnaire. The pre-designed questionnaire was validated on contain number of questions with 4 sections and 20 questions related to the proposal information, demographic data, and the type of diabetes, and by the biochemical investigation, including vitamin D and the lipid profile. For the ethical considerations, this study was guaranteed approval by the local ethics community of the Libyan International Medical University, LIMU. Informed written consent was obtained through consent from that was given to the participation along with the questionnaire. Now for the statistical analysis with my colleague Yahya Asma.
Okay, the statistical analysis. The first thing I'm gonna cover is that the data from the questionnaires was entered using Excel. Data set was exported to SPSS v22 and EPI info for complete analysis. Statistical analysis was carried out for the complete sample, which were created according to the measurements in which frequencies and percentages were used. To determine the differences regarding each categorical variable in the groups, t-test was performed, and p less than or equal 0.05 was considered to be statistically significant. Now the result, the data collected on 165 diabetic patients either have vitamin D deficiency and dyslipidemia, or vitamin D deficiency and no dyslipidemia, or dyslipidemia with no vitamin D deficiency. 61 to 33 and 71 respectively. The average age of the patient were 45, more or less 60 years old, with the predominant ages found 41 to 60 years old by the percentage of 58.2, followed by the age groups above 60 years old by the percentage 34.5, and the age groups between 18 to 29 5 years old being the least by the percentage of 2.42. And regarding the gender distribution as shown in the figure 2, female were shown twice than male by 66.7% and 33.3% respectively. Based on the categorized the patients according to types diabetes found, the majorities of patients have type 2 diabetes mellitus by the percentage 97, and approximately 3% have type 1 diabetes mellitus. Okay, now the figure 1 age distribution of the patients. As you can see, the highest have, as we said, the age group of 41 to 60 years. Now the figure 2, gender distribution, as we see, the higher percentage of the women is 66.67%, as male 33.33%. And the figure 3, types of this diabetes, type 2 diabetes has more than type 1 by the percentage of 96.97% and type 1 3.03%. Now table 1, diabetes, vitamin D, and dyslipidemia status with my colleague Muhammad Sis.
Okay, now for the table 1, diabetic and vitamin D and dyslipidemia status, and the 3 groups that we have. The first one was the the diabetic patient have vitamin D deficiency and dyslipidemia. The second have vitamin D deficiency and no dyslipidemia. The third was dyslipidemia with no vitamin D deficiency. The total number of these cases was 165, and for the dominant percentage was about 43 for the third group, which is the dyslipidemia and vitamin D no deficiency. For the table 2, we have the same groups, but we're talking about here the serum parameters that we have. The first thing is the vitamin and the cholesterol and triglyceride, high density lipoprotein, low density lipoprotein, and the very low density lipoprotein. The dominant numbers were about the third group, which was the most common, and the diabetic patient have dyslipidemia and no vitamin D deficiency was 33 to 5, 139, and 144, less than the second and the first group. Okay, for the third table, we were browsed by the gender from men to women, male to female. We have the same parameters that we have: the cholesterol, triglyceride, high density lipoprotein, low density lipoprotein, and very low density lipoprotein. The main dominant numbers was about in the female more than male. For the cholesterol was 144 to 154. The triglyceride was 141 to 145. The high density lipoprotein was more in men than women, about 73 to 65, and the low density lipoprotein was about 65 to 88 in women. In the conclusion, it seems that the serum 225 or hydroxylase vitamin D levels are closely associated with the serum levels in diabetic patients. The vitamin D may be associated with the increased risk of dyslipidemia, especially in women more than men. The association between vitamin D status and serum levels may differ by genders that we have. Furthermore, vitamin D has been associated with the improved glucose hemostasis in men and overall lipid profile among patients. Thank you very much for listening and watching our presentation.
Action.
Good morning. My name is Abdul Malik with my colleagues Sarah and Jilan. We presenting our research with topic the clinical outcome and the prognosis for cases with metastatic thyroid carcinoma. By the end of this presentation, you will be able to understanding the background about research, the methodology, the outcome of study, and the conclusion. First, with introduction. Cancer. Cancer is a genetic related disease characterized by abnormal cell division, invasion, and distant metastasis of cancer cell from primary sites to other sites in the body. The mechanism underlying vision and metastasis were larger and an enigma. It was clear that as carcinoma arising from epithelium tissue progressed to a higher pathological grade of malignancy. Thyroid cancer is the most common malignancy disease in endocrine system and is rapidly increased in incidence. Most primary thyroid cancers are epithelium tumors that originated from thyroid follicular cells. More than 5 types have been classified under thyroid cancer. Interestingly, each type of thyroid cancer possessing distinct feature and characters. The recent substantial development in understanding molecular pathogenesis of thyroid cancer have showed promising treatment strategies. The histopathological pattern of thyroid carcinoma, we find this is the most common type of thyroid carcinoma: papillary thyroid carcinoma, follicular thyroid carcinoma, and anaplastic thyroid carcinoma. And we have fourth type is called medullothyroid carcinoma from parafollicular. Now with my colleague Sarah to continue with you.
Okay, now I'm talks about aim. The aim of this study was to characterize a range of histopathological patterns in different thyroid lesions in terms of sex, age of the patient, and stage of cancer. Methodology. Divided into 3 points. Patient the medical record of 63 cases of thyroid carcinoma obtained between 12 November 2003 to 29 November 2020 from the Oncology Hospital and BMC Hospital, as well as the Arab Medical University and Pathology Department, were retrospectively reviewed. Only cases that reported that thyroid carcinoma had histological confirmation were included in the present study. The cases consisted of 53 female and 10 male with an average age of 42.5 years, range 17 to 18 years. Until this moment, the data available to us contain a variation, different types, and the stage of disease progression. Most of the cases were of papillary carcinoma and follicular carcinoma. Furthermore, the aggressive type is an anaplastic carcinoma. Patient monitoring, we find the most diagnosed patient in our research is papillary carcinoma. Second one is follicular carcinoma, and the third one is an anaplastic carcinoma. Now with my colleagues Jilan Nazi.
Okay, now I will talk about the study design of our research. We conducted the respectively study using the clinical and histopathological data were retrieved from the hospital's medical archives. Patients who underwent thyroidectomy, the material included 63 thyroidectomy specimens. Histophysiological diagnoses were collected from pathology reports. All these lesions were correlated to age and gender. This study was applied inside Benghazi, as was maintained previously. The rate of women was significantly higher than men, with 84% for women and 17% for the men. It's known the cancer contains stages of disease progression. Stage 0, carcinoma in situ, early form. Stage 1, localized in the one part of the body. Stage 2, early locally advanced. Stage 3, late locally advanced. And stage 4, metastasis or separate to other organ. Most of the cases included in this study were stage 4 thyroid cancer, and this stage is more aggressive. The conclusion. At this stage of our study, we conclude the following. Females accounted for 84% of patients with thyroid cancer. The age of the studied cases ranged from 17 to 80 years with a mean age 42.5 years. Papillary carcinoma is the common thyroid cancer, and the last one, majority of the cases were diagnosed at stage 4. Finally, the reference. And thank you for your attention.
السلام عليكم، معكم الطالب محمد بن ناصر مع زميلي معاذ الشاوش من كلية الصيدلة. اليوم نبدأ عن مشروع التخرج الخاص بنا بعنوان Bacterial Flora Associated with Mobile Phone للهيلث كير وركرز. أول حاجة عندنا كليرنينج أوبجكتيف، هنتكلم شوية كإنترودكشن وبعدين هنناقش الماتيريال والميثود، بعد ذلك هنتكلم شوية عن الريزلت ثم الكونكلوجن. كإنترودكشن بالنسبة للهيلث كير وركرز موبايل فون، يعني في الغالب تكون ريسيفر بوتنشال باثوجينز، يعني إنه ممكن تعرض لللمس during or after examination للبيشنت. لذلك لأن لو ما كانش فيه مثلا proper sterilization or hand washing فحتكون contamination. بالنسبة للدراسة بتاعتنا حتكون تدرس الايزوليت والايدنتيفايد different types للبكتيريا مع الانتيبيوتيك sensitivity لكل نوع. بالنسبة للسامبل كولكشن تم جمع العينات من مستشفى الأطفال بنغازي، والسامبلز الذين تم جمعهن عن طريق سواب كان تحتوي على ستيرايل نورمال سلاين. تم مسح النقالات للعاملين في المستشفى عن طريق السواب في أماكن معينة كانت مثل الأزرار الجانبية للتليفون أو الشاشة أو كالسبيكر اللي عند الأذن أو اللاقط اللي عند الفم. بالنسبة للسامبل انكيوليشن تم جمع العينات، بعدين تم أخذنا مباشرة للمعمل وتم زراعتها في بليتس تحتوي على بد أجار ماكونكي والنيوترنت أجار. ثم بعد ذلك تم وضعها في الانكيوبيتر على درجة 37 سلسيوس لمدة 24 ساعة. بعد 24 ساعة يعني كانت examinated كوجود growth أو colonial morphology. تمام. بعدين بالنسبة للماتيريالز والميثود، بعدين عندنا الايدنتيفيكيشن للايزوليت بكتيريا. استعملنا التريبل شوجر ايرون اللي هو شوجر فورميشن اند جاز برودكشن للايزوليتد كولونيز، تمام، كمعرفه لانها جرام نيجاتيف او جرام بوزيتيف. بعدين استعمال الانتيبيوتيك سنسيتيفيتي، كانت استعملنا انواع معينه من الانتيبيوتكس اللي كان تم زراعه البكتيريا في البيت، حطينا عليهم انتيبيوتيك ديسكس. والانواع اللي استعملناها من الانتيبيوتكس كان اللي هن الانواع الشائعه كاستعمال في دوله ليبيا. مثال عليه الادويه هذين السيبروفلكساسين والجنتامايسين والاموكسيسيلين والاريثرومايسين والاموكسيسيلين، كلافيولينيك اسيد اند امبسيلين اند كلوكسيسيلين. بعد في نهايه الدراسه هذه استعملنا statistical analysis اللي هو ال SPSS كإحصاء لدراسة العينات اللي طلعنا عندنا. طيب، والآن مع زميلي معاذ الشاوش.
السلام عليكم. تو عندنا الريزلت ذكرنا يعني كم خدينا عينة. احنا خدينا يعني 71 عينة زي ما قال زميلي محمد من مستشفى الأطفال من أماكن مختلفة مثل determined of microbiology والدياليسيس والسيرجري والاوبريشن والانتيريال. خدينا من دكتورز كم خدينا 10 وخدينا من نيرس. خدينا يعني جزء اللي في قاعدين في الكليه اللي قاعدين
معلش ايوه، خلينا من الاماكن اللي ذكرتها لكم. بعدها درنا sensitivity result، درنا لهم اختبار رادار sensitivity. خلينا الدراجز اللي قلنا كومن في ليبيا، اللي هن السبرو والجنتوميسين والموكسيسيلين والثايروميسين والموكسيسيلين والكلايفيك اسيد والامبيسيلين مع الامبيسيلين. تمام، يعني هنا توضيح الجدول، احنا عندنا 10 عينات من اصل 71 اكزامبل، يعني ما نجيبش نحطهم كلهم 71 احنا. تمام، يعني تو في المثال الاول يعني ذكر ان في العينه الاولى ان السبرو طلعت معنا، في السبرو طلعت معنا سنسيتيفيتي، وفي الجنتوميسين طلعت معنا سنسيتيفيتي حتى هي، وفي الاموكسيسيلين ريزيستنت قاومت البكتيريا، ثايروميسين حتى هو ريزيستنت، واي تي حتى هي طلعت يعني في الاموكسيسيلين مع الكلايفيك اسيد، وهذا تمام. بعدها عندنا طريقه اخذ السنسيتيفيتي عن طريق المسطره، بطريقه الزوم هذه قدامكم باينه في الصوره. بعدها هنا الاحصائيه ان جنتوميسين والموكسيسيلين او الكلايفيك اسيد كان بنسبه 100% سنسيتيفيتي، والامبيسيلين والثايروميسين كان بنسبه 80%، والسبرو كان بنسبه 60%. بعدها هنا جرام ستين ريزلت، انا عن طريق التريبل شوجر طلع معنا الجرام نيجاتيف وجرام بوزيتيف، وكانت النسبه الاحصائيه جرام نيجاتيف اكثر من جرام بوزيتيف بنسبه 60-40%. بعدها عندنا تريبل شوجر راوند تيستس اللي هي كنا درناها عن طريق التيوب، والبط هذا يعني قاع تاع التيوب كانت لوطه، قاع التيوب ورد يلو. هنا يعني ليش درنا التست هذا؟ على سبب نحددوا اسم البكتيريا. وأنا طريقة طلع معنا الشكل بعد ما حطيناه في الانكيوبيتر لمدة 48 ساعة 24 ساعة، طلع معنا الشكل هذا. كل المدروجات في الجدول هذا 71 عينة، هذين مثال 7 عليهم. بعدها هنا الجدول هذا يوضح اسم البكتيريا، يعني زي هنا في الثانية حقيقة عندنا في البط كانت يلو، في الستان كانت رد، يطلع عندنا شكل سبيسيس نوع البكتيريا وهكذا. conclusion كان our study reveals that defended colonization of bacteria of mobile phone which are every close in hand HWC workers، يعني هم الهيلث ورك العاملين في المستشفى. وان هنا الموبايل فون الموبايل ماهوش ينقل رسائل بس، يقدر ينقل حتى امراض. تمام. بعدها انا ايوه تمام. ويعتبر هنا تو التليفون يعني من خلال الدراسه اللي درناها هو يعني ناقل الامراض، ويسبب يعني فوضى في الهوسبيتال في الهوسبيتال. تمام. هنا يعني قلنا ان النقال يعتبر هو مصدر اساسي في نقل الامراض داخل الى خارج المستشفى. تمام. بعد هنا قلنا في الدراسه تاعنا ان الفون يلعب دور مهم في البوتنشال سبريد، في انتشار البكتيريا، وفي الريزيستنت مقاومه الدراج، مقاومه البكتيريا للدراج، ريزيستنت دراج ريزيستنت بكتيريا into the community. تمام. بعدها هنا the should be regulation around that use mobile telephone in hospital, stating due to their potential of contributed to no infection, nosocomial infection. بعدها أنا الموبايل فونز of health work should could be a friend أو of a few، يعني ممكن يكون صديق أو عدو عن طريق يعني يعتمد على الديبندنت، يعني المفروض إنه ما يستعملش النقال في أثناء ساعات العمل، يكون استعمالها في النقال يكون لا، لأن شنو نقللوا من حدة انتشار الأمراض. And thank you.
My doctor and my colleagues, welcome to our graduation project presentation. Today, me and Khalid Mati with my colleagues, Ritesh Abedi and Muhammad Suwaidi, we will provide an overview of our project, which fall under the title, Quality of and Treatment Satisfactions in Adults with Type 1 Diabetes, Comparison between Continuous Subcutaneous Insulin Infusion and Multiple Daily Injections. So the contents are introduction, aim of the study, materials and methods, results, discussion, and finally, references. Change. So, first of all, we know that diabetes represented a major health problem because it is high prevalence, morbidity, and mortality influence on patient quality of the life and their impact on health system. These impacts involved the physical and emotional overload of diabetes. Added to that, required lifelong treatment. So the impact including lifestyle and pharmacological measures, often with multiple drugs. So we studied quality of life regarded as subjective measure of health and will be related to disease, while treatment satisfaction is a subjective measure that evaluates the patient experience of the processes and results of the treatment. Further, it is known that poor satisfaction with the treatment compromises treatment adherence, which may have adverse consequences on the metabolic control of the disease and the risk of late complications and mortality. So our aim of this study is compare quality of life and treatment satisfactions in adult patients with non-diabetes mellitus treated with either continuous subcutaneous insulin infusion or multiple daily injections. And now continue with my colleague Muhammad Shukri.
Methods and procedures, case control study. Inclusion criteria, number 1, male and female patient with diabetes mellitus type 1. Number 2, aged between 18 and 55 years, treated with continuous subcutaneous insulin infusion or multiple daily injection. And the last one, needing diabetes clinical for a routine visits. And exclusion criteria, number 1, the excluded participants were patient less than 18 years or more than 56 years, and non-Libyan nationalities. And next slide. This is questionnaires, depend of the study. Questionnaires number 1, the short form, 36 health survey is 36 items. Patient reported of patient health. The short form 36 is a measure of health states, and an abbreviated variant commonly used in health economics as a variable in the quality adjusted life year calculation to determine cost effectiveness of a health treatment. And question number 2, the diabetes specific quality of life scale addresses accurately differences between various forms of therapy in diabetes mellitus and indicates the level of patient satisfaction with their current treatment in relation to their individual goals. And the last one, the diabetes treatment certification questionnaires was first developed in the early 1980. It is now we use it particularly in clinical trials, but also for routine clinical monitoring. It's available in more than 100 languages. And next slide. After pilot study, we conclude this final form from 3 questionnaires. Now with my colleague Rita Labidi.
Okay, for the results, because in the new groups of patients take continuous and subcontinuous injection compared with multiple daily injection. This in the gender, we collected male and female according to multiple injection, continuous and subcontinuous insulin, multiple daily injection, and continuous insulin infusion. In the male, according to multiple daily injections, was 50%, and female 45.4%. Subcontinuous insulin infusions was 100% was male and 0 for female. Okay, the age according to multiple daily injection and subcontinuous insulin and infusion, the age between 46 to 55 was 60%, and the age between 39 to 45 was 50%. Finally, 18 to 25 was 100%. The next slide, please. Okay, treatment classifications, questions, and quality of life questions. According to treatment classification classifications, we choose 2 questions, classifications and flexibles according to treatment. First, multiple daily injection. The first here show always with a 16.7%, often with a 27.80%, finally sometimes with a 5.5%. Continuous, subcontinuous insulin infusion with a sometimes and often with the same percent with a 50%. Quality of life questions, we choose to question, thinks about it, and border about measure. First, rarely with the 45%, definitely with a 30%, neither with 25%, or never with 25%, sorry. The next slide. Discussion. In this study involvement, number of patients over 3 centers throughout Bengali city show results or realistic figures about insulin treatment on the subjective outcome. This is assessment quality of life and treatment classification in adults with the type 1 diabetes mellitus treated with either continuous, subcontinuous insulin infusion or multiple daily injection. It is also the first study comparing continuous, subcontinuous insulin infusions with multiple daily injection. Next slide. Finally, before we cannot discuss, conclude, and recommend our results because we still undergo data collected. 6, the reference. This is our reference in this presentation. Okay, the next slide. Acknowledgement. First of all, we would thank our deans, Prof. Salma Abu Khatwa, for her continuing effort. After that, we would like to express special thanks of gratitude to our supervisor, Dr. Hana Habib, for all his support for us in every step. Also, all thanks our co-supervisor, Dr. Naila Nasser and Samah Atrabulsi for great effort and support. Finally, we would also to thanks all teaching staff and our head of research community, Dr. Hanin Hassan, for her follow-up. Next slide. Thank you for your attention.
Welcome everybody. My name is Nahla Al-Hussein. I'd like to introduce you my colleagues Adil bin Nasser and Sundus Muhammad. Our presentation supervised by Dr. Salma Bou Khatwa. In our presentation, we will discuss psychostimulant drugs abuse among Libyan medical students. Psychostimulant drugs such as amphetamine, caffeine, and nicotine intake causes high abuse potential as they increase physical activity, mental alertness, and attention. Students generally excuse this abuse in order to enhance their academic performance, so they can study for hours without requiring a break. According to the latest statistic in Libya, published in 2018, there are about 141,413 medical Libyan students. This study was designed to examine prevalence of use of psychostimulant drugs among medical students for medical reasons, abuse of psychostimulant drugs among medical students, and the relation between drug abuse and personality measures among medical students. Methodology. A structured questionnaire about potential psychostimulant drugs use was distributed by electronic means, which are Google Form, among medical students from various levels at different faculties from all medical universities located at Libya. The ethical approval to perform the investigation was obtained by Ethics Committee at LIMU. The questionnaire consists of 4 parts: personal information, financial information, scientific question, and general information. The questionnaire was confidential as the students weren't asked to write their names or any other symbol indicating their identity. Result and discussion. Students from 20 universities were participated in this study. The highest percentage of participants were from University of Benghazi, which represent more than 50% from the total number of participants, followed by Tripoli University, which represent 12%, then LIMU, which represent 11%. Interestingly, Faculty of Medicine represents the highest percent, which may be due to it contains the highest student numbers. According to sex, female population represents 73%, while the male population represents 27%. According to age, the highest number of participants was from 18 to 21, which represent 47%, and from 22 to 25, which represent 44%. And from 25 to 30 and more than 30 represent a small number. According to the marital state, single state represents the highest percent. According to the nationality, 97% of the study sample were Libyan. Here, the participants were asked some questions in order to prospect and evaluate their financial state. As we see in question number 1, the participants were asked if they had a job. About 78% said no. This means that a large percentage of them depend mainly on their family. And in question number 2, the participants were asked, is it easy for them to meet their monthly expenses? The answer varied from time to time and always. And in question number 3, they asked if the intake of psychostimulant drugs cost them a lot of money, about 70% referring it doesn't. Now let's discuss the mostly used psychostimulants with my colleague Sondus.
We will start with the most used psychostimulant, which is caffeine. About 82% of the participant students take caffeine, and we found increased rate of caffeine consumption, about 77% when entering university. We found not only the examination period increased rate of caffeine consumption by students, also we found bad mood and stress. quitting caffeine, about 47% of the participant students were trying to stop taking caffeine, but 75% of them successful in quitting. Moving to nicotine. Approximately 87% of the participant students were smoking, and we found increased rate of cigarette smoking in starting university. We found the main reason for smoking was stress, followed enjoyment, also to concentrate, then during examination period, and for social image. Nicotine quitting, most of the participant students were attempted to quitting smoking, but 75% of them were they failed in quitting. Now moving to amphetamine with my colleague Hadid.
Amphetamine intake. Participants were asked if they take amphetamine. The majority of answers said no, while about 7% said yes. Also, they were asked about when did they start taking amphetamine. The majority of answers, which represented 81%, said that they started taking amphetamine since entering university, while about 19% said that they started taking amphetamine before entering university. Here, participants were asked about their reasons for taking amphetamine. Almost 52% said that they use amphetamine during examination period, 19% said for physical performance, 15% for stress, while 13% use amphetamine for weight loss. This pie chart presents students' awareness about the harmful effect of amphetamine. About 56% said yes, that they were aware, while 44% said no, that they are not aware about the harmful effect of amphetamine. Here, participants were asked if they have ever considered quit taking amphetamine. About 61% said no, that they have not, while 39% said yes, they have. Also, they were asked if they were successful in quitting amphetamine. The vast majority of answers, which presented about 72%, said no, they were not, while about 28% said yes, they were. Students also were asked about their opinion regarding substances used to enhance their academic performance, that if they would perform better if they used a psychostimulant substance, and if those psychostimulant substances would provide an advantage for students who take it, compared to those who don't. Although the participants said that they use stimulants to improve their academic performance, but some of the participants confirmed that there is no an academic improvement compared to those who don't take the stimulants.
In conclusion, this study revealed the most used psychostimulant substances such as amphetamine, nicotine, and caffeine by medical students in Libya. Caffeine was identified as the most used stimulant, followed by nicotine and amphetamine. The use of such substances by medical students is a phenomenon that should be evaluated systematically due to its prevalence and potential impact. Thank you for listening.
Hello everyone, welcome to our presentation. Today, me Hajj Farhat with my colleagues Fatma Abdullah and Marwa Khalid, we will talk about the relationship between vitamin D and breast cancer. First of all background, vitamin D is a fat-soluble vitamin. There are two major isoforms of vitamin D, vitamin D2 and vitamin D3. Vitamin D is considered deficiency at least 20 nanogram per milliliter, deficiency, insufficiency from 20 at 31 nanogram per milliliter. Optimal at more than 32 nanogram per milliliter. Role of vitamin D. Vitamin D plays a role in calcium and phosphorus homeostasis. Its deficiency has role in cancer development. Breast cancer. Breast cancer is the most common malignancy among women, the second leading cause of cancer death among women. Vitamin D have anti-carcinogenic properties, including inhibition of cell proliferation, invasion metastasis, and angiogenesis, induction of apoptosis and differentiation. The main source that we get vitamin D is through UV exposure or our exposure to sunlight. Also, we can get vitamin in small amount in food. First step in vitamin D synthesis is converting hydrocalciferol into cholecalciferol by liver enzyme 25-hydroxylase will converted cholecalciferol to calcidol. Then by kidney enzymes, calcidol will be converted to calcitol, which is the active form of vitamin D. This active form will function in reducing proliferation of cancer cells, angiogenesis, which is the formation of new capillaries that supply cancer cells, and inflammation, and enhancing calcium absorption, differentiation, and immunity. And now with my colleague Fatma Abdullah.
The same result study, where the conducting on association between vitamin D and the risk of breast cancer. Same of them show there's no association between the two this. An example as study, why others show that there is an association between vitamin D deficiency and breast cancer. لو قدرنا نوضحوا the relationship between vitamin D and risk breast cancer, we can try to reduce the risk of breast cancer in our population. So the aim, it is a project. Primary, evaluated vitamin D3 levels in breast cancer female patients in Benghazi, Libya, and investigated if it is deficiency is association with the cancer. Secondary, examine the association between vitamin D deficiency and the calcium level in this patients. This can be achieved by collecting data from patient archives from the Radiology and Oncology Department of Benghazi Medical Center, collecting data from controls. Methods, vitamin D3 levels of 10 breast cancer patients were recorded from Benghazi Medical Center in Benghazi. Similarly, vitamin D3 levels of equal numbers of approximately age matched للhealthy females were recorded after signing an informed consent agreeing on sharing their information for research purposes. Vitamin D deficiency was considered at serum level less than 20 nanogram per milliliter. Additionally, calcium levels were recorded for both case and control as a secondary parameter. Now my colleague Marwa Khalid.
Result. For the cases, 2 of the cases have normal vitamin D3 level and 8 abnormal vitamin D3 level. So only 1 abnormal in this case calcium level. For the control, 2 of the control have normal vitamin D3 level and the rest are abnormal for vitamin D3 level. Only 1, the patient, is abnormal calcium level and the rest normal for calcium level. In conclusion, findings of our project conclude that vitamin D3 deficiency associated with the risk of breast cancer. Regarding calcium level, it is not that it's normal in the majority of both cancer case and the control. Similar result, but with large sample size, were finding in provides research study where vitamin D3 measurements were below that normal in both the breast cancer patient and the healthy control. On the other hand, other research papers have showed that vitamin D3 deficiency is considered as prognosis to the users and identify the stage of the cancer. Finally, future plan. The sample size is small due to the fact that here in Benghazi, cancer patients are not being asked to measure trial vitamin D3 level, so as part of other diagnostic routine. Therefore, it's suggested that vitamin D3 level should be taken in account so future study can be conducted. Thank you for listening. Reference.
Hello everyone. Today we are going to present our project under the title of Comparative Evaluation of Different Brands of Diclofenac Sodium, Tablets and Suppositories by me, Aya Al-Mahdoui, my colleague Hadil Abidi and Abrar Bousefita, under supervisor Dr. Nohal Mabrouk. Objective of this presentation: introduction, material and method, result, discussion, last but not least, conclusion, and finally, recommendation. Quality management is a systemic process for determining whether a product or service meets the specified requirement. Quality assurance stabilizes and maintains set requirement for developing or manufacture reliable pharmaceutical product. Therefore, a quality control system is meant to increase customer confidence and the company's credibility, while also improving work process and efficiency. Moreover, pharmaceutical research, development, manufacture, and quality control testing are supported by British Pharmacopoeia that annually publish a collection of quality standards. Diclofenac sodium is the most common type of non-steroidal anti-inflammatory drug, which is stabilized to treat symptoms of fever, inflammation, and pain. Consequently, reducing these symptoms helps you do more of your normal daily activities This drug is available in different dosage forms. One of them, oral diclofenac, such as tablet, and rectal diclofenac suppository. Diclofenac sodium is a non-selective, reversible, and competitive inhibitor of COX. Aim of study. In this study, comparative evaluation between a different dosage form, tablet and suppository, of different brands of diclofenac sodium were randomly selected from community's pharmacy in Benghazi and investigated in terms of the physical and chemical aspects. Material and method used in this study. First evaluation of tablet. Sample of 2 commercial brands of enteric-coated diclofenac sodium. As described in Table 1, identification criteria of diclofenac sodium 50 mg tablets. Brand 1, all information is available in package, and brand 2 is all information is available except the manufacture date. Investigated product. The brand 1 is yellowish color, and brand 2 is white color. The surface thickness of both brands is smooth. Second evaluation of suppositories. Sample of 2 commercial brand diclofenac sodium. As described in Table 2, identification criteria of diclofenac sodium 100 mg suppository. Brand 1, all information is available in package, and brand 2 is all information is available in package except the batch number. Investigated product. The brand 2, it has no defect, but the brand 1 is defects of shape and dose. Now with my colleague Hadil Abidi.
Hello everyone, I am Hadil. I will talk about method used in this study. Tablet appearance. Sample of 20 tablets from each were at random elected and their appearance properties such as color, form, flatness, shape. Described based on the visual observation. Was first test of tablet is hardness test. Tablet hardness has been defined as force recurrent to break tablet in the metric compression test. This can be calculated by measuring the degree of force is necessary to fracture the dosage form. Second test is weight uniformity test. Uniformity of dosage unit, urban pharmacopoeia, content test for determination of dosage unit uniformity by weight variation. Third test is content uniformity for tablet. This is measurement of variety in activity ingredient from patch to patch. Fourth test is dissolution test. This test used to determine the amount of activity ingredient that are released from solid dosage form during a specified period of time using the known volume of the dissolution media under carried tablet dissolution. And finally, test disintegration test from tablet. This test used in induct whether solid dosage form will release it in content in vivo and carry it out in liquid, usually water, 37 necessary. The endpoint is usually described as start release of the content, visual describe of disintegration. Suppository apresia. Sample of 3 suppositories were randomly selected from each of the 2 different companies for diclofenac sodium and described based on the visual observation, their appearance properties such as surface shape. Was first suppository test is hardness test. This test is designed as method for measure the variability or brightness of suppository. And finally, test for suppository is disintegration test. The test form disintegration of substrate determine whether substrate disintegrates within the prescribed time with the placed in liquid medium under prescribed experimental condition. Now we've talked about study result. The result of each drug will be compared to the standard bridge pharmacopoeia. First table describe experimental result of both brand tablet evaluation. Second table describe experimental result of both brand of substitute evaluation. Now my colleague Abrar Bousfita.
Hello everyone, I am Abrar. I will talk about discussion part. First, all discussion of tablet. Regarding kernel test, both brands are within the pass limit. And this means that tablet hard weighting is important parameter for tablet that assists the tablet resistant to package as a result of transportation, strong and healthy. In different study in 2015 used the hardness test for the four brands of diclofenac sodium. The results were confirmed with standard pharmacopoeia. Disintegration time for the two tablets brands accepted critical for absorption process as it is considered the emitter step. The dissolution test results for both drugs were rejected output the pass limit. According to the result in table 1, the content uniformity of brand 1 less than accepted less limit, while the brand 2 was higher than the pass limit. Therefore, viability and therapeutic effect of the drugs will be affected. Both drugs this with the weight uniformity test, which means the tablet of each drug do not show the excessive weight variation that may affect the drug's content. Second, all discussion of suppository. Regarding hard test of brand 1 shows the pass limit, while brand 2 confirm the pass limit of bridge pharmacopoeia specification. According to the result in table 2, brand 1 failed pass limit because collapse enforcement saw the suppository in the soft and possible. In regarding to disintegration test, both of brands confirming pass limit of a bridge pharmacopoeia specification. Conclusion it's in this study included this can be concluded that the market sample of diclofenac sodium tablet and suppository was analyzed by using stabilization method. This study confirmed that the result of all parameters obtained combined with the pharmacopoeia limit, excluding the two assumed regarding the manufacturer data of a brand 2 tablet and appearance texture of a brand 1 suppository. Therefore, and on the basis of those results, we can recognition that product of diclofenac sodium available in Benghazi meets most of the quality parameter to sustain the therapeutic efficacy. Recommendation from this study it is important to mention the the quality of product by performing variation, quality control, virus, quality control test, open it market, make sure that it's safe for that the public domain. Quality control evaluation is essential investigation in order to maintain the efficacy and quality of the overly pharmaceutical product. Quality control testing should be applied also to answer that the drug's adherence to the directives as per the description and that tested on the drug's label according to British Pharmacopoeia specification. An example of sample reference used in this study. Thank you for attention.
What you were talking about the assignment of bacteria, contamination of avian bankinosis and cousins in circulation in the markets in Benghazi City. My Khalid Sheikh and with my colleague Mahmoud Khalid and Sufyan Lamami. Objectives, introduction, material and method, result and conclusion. Introduction or goals in this research and investigation determined now to assignment of bacteria, contamination of Libyan bankinosis and cousins in circulation in the markets in Benghazi City. Collecting cash sample from different places such food stores, malls, gas stations, and other places. Producer testing the isolation bacteria for antibiotic resistance. Material and method in 5 steps. Step 1 هي sample process إن هي نجم العينات من فود ستورز وفيجيتابل ستورز والفارماسيست والفيش شوب. ستيب 2 هي كالتشر اند ايزوليشن ان هي نحطوا السامبل في الكالتشر بلاد اجار والماكونكي ونديروا نحطوهم في الانكوبيتر في درجه حراره 37 درجه مئويه. ستيب 3 هي identification of isolated هي نديروا مورفولوجي اللي نعرف فيها الجرام رياكشن بتاعها في البايو كيميكال تكنيك ونديروا التربل شوجر ايرون تيست. ستيب 4 ان هي الانتيبيوتيك سنسيتيفيتي تيستينج ان هي نعرفوا فيها اختبار السنسيتيفيتي بتاعها في الايزوليشن عن طريق الادويه المستخدمات في الليبيان هوسبيتال يعني في التريتمنت المستخدمات عندنا السيبروفلوكسين والجنتاميسين والاموكسيلين والاثروميسين والاوجمانتين والامبيسيلين كلوسايكلين. ستيب 5 ان هي شنو سيستيكيتد اناليسيس ان هي شنو نعرفوا فيها الاحصائيات وندرجونها عندنا. and with my clinic result محمود خالد.
Now result السامبل كوينز اند البليسز الاماكن اللي خذينا منهن. السامبل خذينا 10 عينات من اصل 100 عينه. الكوينز خذينا من الفئات الربع وال50 والجنيه وال5 جنيه وال10 جنيه وال20. البليسز خذينا من اماكن مختلفه كيف الفيجيتابل ستور والميت شوبس والفود ستاف والمخابز والكافيز. sensitivity result 6 الادويه اللي السبروفلوكساسين والجنتاميسين والاموكساسيلين والاريثروميسين والاموكساسيلين والكلافينيك اسيد اللي هو الاوجمانتين والامبيسيلين والكلوكوكسيلين. ال6 دراجز هذين يقاومون في البكتيريا. الجنتاميسين والاموكساسيلين والكلافينيك اسيد نتيجه السنسيتيفيتي كانت 100%. والامبيسيلين والاريثروميسين والكلوكاسيلين نتيجه السنسيتيفيتي كانت 90%. والسبروفلوكساسين ان هو نتيجه السنسيتيفيتي كانت 70% المقاومه. sensitivity result الهالة الشفافة اللي حول العينة قسناها بالمسطرة ولو كان أقل من 14 هيقعد فيه resistant ولو كان من 15 ل 16 الانترميديت ولو أكثر من 17 هيكون فيه sensitivity. الجرام ستين result صنفنا الجرام ستين result إذا كان positive أو negative. طلع معنا النيجاتيف أكثر من البوزيتيف. النيجاتيف كان 70% والبوزيتيف كان 30%. Now with my colleague سفيان الأمان.
السلام عليكم. عندنا تريبل شوجر ايرون تيست. الغرض من هذا الاختبار هو تصنيف البكتيريا ومعرفة اسمائها. في هذا الاختبار يتم استكشاف نوع العينة عن طريق الألوان والجازز والH2S. عندنا الصورة توضح شكل العينات بعد الاختبار، وهنا عندنا على اليسار الجدول هو المرجع لمعرفة اسم كل نوع بكتيريا. تمام. بعد عندنا الكونكلوجن. الكونكلوجن هو في نهاية العرض المبسط لمشروعنا تم تأكيد عن انتقال البكتيريا بأنواع مختلفة بواسطة العملات النقدية، وسوف نكمل بحثنا في معرفة إذا كانت انتقال البكتيريا بالعملات الورقية أكثر من العملات المعدنية أو العكس، ولا يزال البحث قيد تحديد أسماء البكتيريا وتحديدها. شكرا.